Hold the Follistim pen and remove the blue cap portion of the pen and place it off to the side. Separate the blue and yellow sections from each other by unscrewing them and set them down on the counter. Pick up the Follistim AQ cartridge, making sure the liquid is clear with nothing floating in it. Disinfect the rubber stopper at the metal cap by wiping it with an alcohol swab. Now hold the yellow section of the pen in your hand and place the Follistim AQ cartridge into the pen with the metal rim going in first. Take the blue section of the pen and screw it into the yellow section completely. Make sure that the skinnier black portion of the pen reaches the inside of the cartridge. The arrows in the center of the pen must match up before proceeding. Disinfect the tip of the yellow end with an alcohol swab. BD microfine needles must only be used once. Make sure to use a clean needle for each injection. Remove the seal from the BD microfine needle and, while leaving it in the protective cap, twist it firmly into the yellow end of the pen. Do not let the sterile needle come into contact with anything, even yourself. There is an outer and inner cap covering the needle. Carefully remove the outer cap followed by the inner cap, but keep the outer cap as you will use it later for disposal of the needle. Invert the pen and hold it upright. Gently tap the side of the pen and bring any air bubbles to the top. Look to see if a droplet is formed at the tip of the needle. If you do not see a droplet on the tip of the needle, dial the dosage knob until you hear one click. Press on the administration button until you see a drop at the tip of the needle. If needed, repeat this process until a drop is formed in order to administer the correct amount of the medicine. You are now able to apply a specific dose to the pen for the injection. There are 3 dosages that the Follistim AQ cartridge will contain: 300 IU, 600 IU, and 900 IU. For any dosages between 25 IU and 450 IU, turn the dosage knob to the correct number of prescribed medication. If the dosage amount mark is missed, do not try to turn the knob in the opposite direction. Instead, keep turning or dialing the dosage knob until the amount passes 450 and there is no resistance on the dosage knob. Press the dosage knob in until it clicks and reaches the beginning position. You can now dial the pen to the dosage prescribed. Once the correct dosage is reached on the pen, it is time to prepare the injection site. The injection site will be a subcutaneous location that has been specified by your physician. The most convenient site for a subcutaneous injection is in the abdomen around the navel. Make sure to switch sides of the injection site after each injection to help reduce injection site reactions and bruising. Disinfect the injection site with an alcohol swab and allow it to dry. Pinch a fold of skin between your fingers at the injection site. Insert the needle in its entirety and press the dosage knob until all of the medication prescribed is administered. Wait 5 seconds with the needle inserted prior to removing. Once the needle pen is removed, apply pressure to the injection site with a gauze pad. A Band-Aid may be applied if needed. Place the outer cap of the needle from before on a flat surface. Do not hold the cap in place or you will risk puncturing your finger. Place the needle into the cap with enough pressure that the lid does not fall off. Once the lid is firmly on the needle, unscrew the needle and cap from the pen. Place the needle into your sharps container. If there is no medication left in the cartridge, disassemble the pen by unscrewing the blue and yellow sections and remove the cartridge. Dispose of the empty cartridge in the sharps container. Reassemble the pen and place the cap covering the yellow portion of the pen. If there is medication remaining, Place the cap back onto the pen and store the pen. Thank you for watching this instructional video